Hello, we are from Group 9. My groupmate and I had choose the activity of health promotion event about COVID-19 and to develop personal skills of the community. From this COVID-19 health promotion event, we are aimed to provide health educations by letting the community to know about COVID-19 and let them recognize the misleading information as well as to learn from the practical steps to protect their family from getting COVID-19. And this is me and my group members, a total of 5 in Group 9. COVID-19 is a pandemic infection and communicable disease that's caused by SARS-CoV-2 virus via airborne transmission, such as through microscopic bodily fluid droplets as well as aerosol particles that accumulated around the environment. It presents an atypical pulmonary-like illness, a respiratory-related disease, plus COVID-19 is a zoonotic disease. Its natural reservoir is animals and humans, which show is initially native to bats and transferred to human hosts through intermediate animals like raccoon dog that were found illegally sold in Huanan seafood market. But then the virus particle of COVID-19 are transmitted through inhalation and direct enter the respiratory tract.
And now let's move on to our target audience. We target people of all the ages because we belong to one community: children, teens, adults, caregivers, and also older adults. To our children out there, I would like to say is that your small habits bring strong changes, and to our adults and caregivers, encourage healthy habits at home, school, and work. Every step you take inspires the younger generation, and also keep the shared spaces clean. To our older adults, your wisdom guides us. Stay active with lighter exercises, and also to take care of your health, schedule regular checkups. To families everywhere, health is a team effort. Cook together and also make wellness a game. Together, let's build a culture of care. Every age, every stage, and every choice leads us to a healthier future. So basically, now I'll talk about the local issues which will lead to global issues. The local issues are respiratory illness, which still affects the families, schools, and workspaces. The misinformation that happens on social media, which causes confusion across people and across students. So people need a trusted guidance for everyday decisions, which leads to global issues. Because if people are miscommunicated or if misinformation is spread, then it leads to global issues. And also, our WHO also reports that COVID-19 reversed a decade of life expectancy, which exposed health system vulnerabilities. So now let's move on to our main goal and our objective. So our main goal today is simple but powerful. Like for example, to understand the COVID-19 and also how to prevent it from myth and also replacing them with fact. For example, first of all, let's talk about the transmission, how COVID-19 spreads and how our everyday choices matters. Like for example, covering a cup, washing hands, or staying home when sick all matters. Secondly, we focus on prevention actions. Vaccination is one of the strongest shields we have right now. You also can use masks and also use sanitizers to prevent it. Thirdly, we must debunk information. For example, rumors can be risky. Stop spreading rumors. False claims about vaccines. Clear, trusted evidence is necessary. From knowledge to prevention to family protection, that is our path forward. Together, we can replace risky rumors with evidence based facts and build a culture of care where every choice strengthens our community. So, let's commit today by learning the three: to learn from the truth, to practice prevention, and to protect one another. Because we act with knowledge, we act with power.
I'm Javier. So I'm going to talk about the issues with COVID-19. To start with the virus, it is very fast to transmit and it lowers the immune system for people. So people like old people and children will get infected more easily. This also leads to diseases such as tuberculosis, which is very threatening, and other respiratory diseases that may cause more problems than COVID-19 itself. When it comes to people, some people lack comprehension on how this disease work, so they will usually refuse the higher authorities' advice. So they'll think that they know better, and they'll follow that. So this also makes it so they have lack of awareness, and it will affect people near them and cause them to feel sick. Obviously, at the start of the pandemic, this virus was really widespread, so it caused the hospital to be very overwhelmed because there was also a lack of equipment and lack of staff. And then finally, for the medicine, there is obviously the issue of this virus having multiple variants, and the vaccine doesn't stop all of the COVID-19 variants, which cause it to have a lot of different effects, especially in the diagnostic testing, where it can be very easily affected by false positives and false negatives that is caused by these variables.
Now, let me explain briefly about our event, COVID-19 Smart Fighters, which consists of two main activities. First, the Mythbusters Challenge. This is a team based quiz where participants vote on COVID-19 myths versus facts and earn bonus points for explaining the science evidence. Second, the Fact Fighter Showdown, where each participant creates a 30 to 60-second video debunking a myth in their own words using our event hashtag. So, to motivate participation, we have a reward system here. All participants receive a small gift like a face mask or hand sanitizer. The top scorer receives a certificate of excellence. The best video evaluated by our organizers receives a certificate of creativity. And the video with the most likes within 1 week wins a health hamper. These activities and rewards work together to build personal health skills through fun, interactive learning.
Through our health promotion program, we expect participants to gain a better understanding of COVID 19, including how it spreads, how to prevent it, and the importance of using reliable health information. All the information are coming from different kind of reliable sources. We also hope to encourage the positive health behaviors such as practicing good hand hygiene, staying home when sick, and making informed decisions about the vaccination. Through our interactive activities, the participants will learn to identify COVID 19 myths, communicate accurate scientific facts, and confidently share this knowledge with their family and friends. Overall, our goal is to create a more informed community that can make the healthier decision and help reduce the spread of COVID 19 misinformations. To evaluate the success of our program, we will use four simple methods. First, participants will complete pre and post event quiz to measure the improvement of their COVID 19 knowledge. Secondly, we will access the engagement through the TikTok myth busting videos by looking at the number of the submission and the public interaction. Third, the participants will complete a short feedback survey to evaluate their satisfaction and the confidence after the program. Finally, we will look at behavioral changes such as participants apply the preventive practices and share the accurate health information with others. These measures will help us determine whether our program has achieved its health promotion goals or not.
In conclusion, COVID 19 is not just a medical challenge, but also a challenge of awareness and misinformation. Through our COVID 19 Smart Fighters program, we hope to empower individuals with accurate knowledge, encourage healthy behaviors, and inspire communities to make informed decisions. Remember, every small action, whether it's practicing good hygiene, sharing reliable information, or correcting a myth, can make a big difference in protecting ourselves and those around us. Thank you very much for your kind attention. We hope our presentation has been informative and meaningful.